Now to the coronavirus pandemic. Tonight, British pharmaceutical giant AstraZeneca is looking for 30,000 Americans to volunteer to get their new experimental vaccine. A portion of the phase 3 trials will take place in the Woodlands. But if two other companies already have vaccines that they claim is 95% effective, why are other companies still developing vaccines? Channel 2's Michael Lopardi live in the Texas Medical Center tonight to explain all that. Michael?
Dominique, the doctor that I spoke with seems to think that having more than one would be a good thing, especially if one turns out to be more effective with a certain segment of the population. But he said, don't expect to have a ton of options early on. In 1 week, two big developments in the fight against the pandemic. Both Pfizer and Moderna said their vaccines are around 95% effective against the coronavirus.
We are at the beginning of the end. We're not at the end, but the end is now in sight, which is great news.
Dr. James McDevitt is Dean of Clinical Affairs at Baylor College of Medicine.
This is really the first time we're going to be able to tell people what they should do, and we're going to have some control over the virus. So to me, that's very encouraging.
On top of that, researchers are now recruiting people in the Houston area to test out AstraZeneca's vaccine. So which one should you ultimately get?
Any vaccine that's authorized by the FDA, I will take. And if it turns out that one of these doesn't last very long, you know what? So what? I can get boosted later on.
Dr. Peter Hotez, also with Baylor, weighed in on MSNBC.
Don't try to overthink this and wait, for a certain vaccine. Take what you can get to save your life and your family's life.
Dr. McDevitt agreed and pointed out some challenges that could pop up early on.
When the vaccine comes out, we're not going to have enough to vaccinate everyone simultaneously. So it'll be in stages.
And there may only be one vaccine available to you, depending on where you live. Dr. McDevitt says the process of getting the vaccine approved, manufactured, and distributed to a large portion of the population could take months, possibly into next fall, and that's why he says we're not at the end just yet. We're live in the Medical Center tonight. Michael Lopardi, KPRC, Channel 2 News.
Thank you.